Everybody, I'm Rowlands and welcome to the first ever NHE365 virtual conference brought to you by leading industry news brand National Health Executive. So we've launched this platform, NHE365, with the feedback of the many readers engaging with the news and analysis that National Health Executive delivers every single day. And the feedback we received from you, our audience, was that you all wanted a community-led festival of events that delivered quality conversation on relevant topics. And I think we've been able to deliver that in spades over the coming months, and certainly today with a great lineup of speakers that we've got. The ability to watch speakers and panel discussions live and on demand was really important too. So think of NHE365 as Desflix for the NHS. And the opportunity to network with peers and continue those conversations long after the conference has finished was really important to you all. Sharing best practice and collaborating is key to the platform, it's key to health service, and it's key to improving patient outcomes. I'd like to extend a huge thanks to the team though. They've worked tirelessly behind this project. It's been a colossal task, and they've delivered an exceptional platform with lots of amazing gizmos and gadgets, from networking, gamification, to getting the speakers live on your screens. You've done an amazing job. Thanks very much. Over the next 12 months, we've got an action-packed calendar of events lined up, discussing everything from artificial intelligence to improved patient outcomes, and much more besides. But it's your platform, it's your community. And if there's a topic that you'd like to address, then connect with me in the meeting hub. Send me a message, or we can even have a video call. It's your voice. It's an opportunity to address the challenges, share best practice, and communicate with one another. An opportunity to connect and collaborate with peers, industry leaders, working together to deliver improved patient services. So without further ado, please welcome to your screens Dr. Afzal Chaudry from the Cambridge University Hospitals NHS Foundation Trust. Have a great day.
Good morning, everyone. I'd like to thank the organisers for the opportunity to present this morning. And I'd like to take you through our digital journey really over the last 10 years, if I may. Next slide, please. Just by way of declaration of interest, just to say that I do work for both HIMSS and CLASS on their European and International Advisory Board. Next slide, please. So a little bit about our hospital. Pre-pandemic, we had just over 1,200 beds. That's slightly reduced at the moment, but we serve a population area of between 530,000 and 4 million, depending on whether or not you're talking about local work or regional work. And on some occasions, we act as a national centre. And you can see on the slide there the sort of rough order of magnitude of patient care that we provide, ranging from 126,000 ED attendances to 853 outpatient attendances a year. Next slide, please. Back in 2010, we started a journey which ultimately really started when the Trust signed contracts in 2013 for the implementation of a hospital-wide electronic patient record, as well as a wholesale renewal of our infrastructure. And this timeline shows a sort of 18-month period from April 2013 through to October 2014, when we went live with the Epic electronic patient record system. And during that process, we revamped all of our network, all of our Wi-Fi. We deployed, we replaced all of our regular desktops. We deployed workstations on wheels, handheld devices, and we held hundreds of validation sessions with many clinicians and operational colleagues to make sure that the system that we configured and went live with would be suitable for NHS care in our hospital. Next slide, please. And so on the day of go live in 2014, essentially all of our inpatient and outpatient care was provided by the system, and the entire hospital went live, 11,000 staff, every discipline, all on one day. And in addition to that, we'd also deployed medical device integration from our theatres and our labs and our point of care testing. And later on, throughout 2016, we went on to deploy a patient portal, some check-in kiosks, and then more recently, 2018, Care Everywhere and EpiCare Link, which are links out through to secondary care hospitals and to primary care. And then during the pandemic, we were able to deploy GP Connect. So at this point in 2014, essentially the entire hospital was working in a single integrated system. Next slide, please. So one of the things when people talk about digital maturity and your approach to that is really trying to understand what it is. In my head, digital maturity is not about necessarily having more technology or better or faster technology. And it's not about functionality or capability in the sense of just asking people, do you have X or can you do Y, is not enough. It really is about how you're using it and what benefits it's bringing for your patients. And most importantly, it's not necessarily just digitizing your current paper pathways. It really needs to be about a wholesale re-engineering. Next slide, please. And so I like to think of digital maturity as it's a journey really, and it's a never-ending journey, and it's about moving your healthcare system towards becoming a data-driven and learning healthcare system where technology underpins everything you do. And it's about congruence in the sense that the digital strategy and the digital aspects really need to align with operational strategy and workflows, working towards a set of desired outcomes. And the reality is that those outcomes are not going to be of any meaningful value until ultimately they result in the delivery of ever-improving high-quality care. Now, we had a very clear vision about what we wanted to do, but what we have worked on over the years was how do we get from where we were, so pre-implementation, then through to implementation to where we wanted to be, where we saw our vision as. And that is not a straightforward process in as much as you have to bring your entire hospital with you in order to achieve that. And so we settled on two broad strategies. Next slide, please. One of those was about the concept of joined up healthcare for our patients. And if you start at the top with the blue icon, that was about the in-hospital work, in the Epic electronic patient record. And then moving clockwise, we have My Chart, which is the patient portal, GP Connect, then Epicare Link, which is a portal for GPs, and Care Everywhere sharing with secondary care. And whilst I recognize that now, there's a lot of work going on in the NHS, and there's some really good examples of the shared care record around the country in places like Bristol and Yorkshire and Humberside and the Great North Record and so on. Back in 2014, for us in Cambridge and Peterborough, this was really very, very new. Next slide, please. And the other methodology that we set out in terms of how we were going to define the route towards achieving really successful and meaningful digital maturity was we settled on using the framework that was provided by HIMSS. So HIMSS have what they call an EMR adoption model, and the critical term there is adoption. So it's not measuring what you switch on or what you might theoretically do, it's measuring what you do and how that impacts upon patient care. And they have a model that goes from stage 0 to stage 7, with stage 7 being the sort of in effect true paperless hospitals. So we use that model not as a directive, but really as a framework upon which we reinterpreted our own local healthcare parameters and opportunities to say these were the areas that we could focus on as a hospital. Next slide, please. So we implemented our patient portal, and between December 2018 and 2020, you can see the numbers have increased, that we've recruited more and more patients to using the portal. At the end of last year, it was just under 57,000. Now we've got over 66,000 patients signed up. And we've moved to a mechanism whereby patients can see much of their own record, and results are released automatically to them, about 138,000 every month. And those results are released at the same time as the clinicians see them. Next slide, please. For integration with secondary care hospital, here you can see that currently with the blue bars, we're approaching 40,000 records a month with other secondary care hospitals of similar maturity. And we ourselves are receiving records approaching sort of 3,500 to 4,000 records a month. Next slide, please. And then with GP Connect here, again, we've really grown this since the spring of last year, and our clinicians find it immensely valuable to see information in the GP record approaching 30,000 transactions per month as well. Next slide, please. But most importantly, we worked on what's better for our patients. And here are some examples. So, as I said, we have device integration, physiological monitors and ventilators in theatre, decision support in pharmacy, and relating to allergies is saving us over 800 significant adverse drug reactions per year. And we have a number of other technological benefits with automation connected to the robot in pharmacy for reducing time to dispense take-home medications. And for our critical care colleagues, certainly pre-pandemic, automated calculation warning scores calculated by a nurse in real time by the system when the nurse enters the information using a handheld device at the patient bedside, then triggers alerts and messages in the system to help support the rapid response team. Next slide, please. And here we have other benefits for the wider hospital. So we've saved a lot of money on dealing with medical records, as you might imagine. Our real-time bed occupancy information has helped us considerably during the pandemic, and working with the regional colleagues to make sure that we share resources across the region in those circumstances. We have automated pathways where clinicians will undertake their clinical work, and just by virtue of recording information, that will trigger the RTT calculations within the system, the referral to treatment times, which means that we don't have armies of admin teams sort of following up on that like we used to. And we have tools within the system that can use automated methodology so that clinical information, again recorded by the clinicians as part of their real-time care, is automatically drawn together when they come to document their letters. And that means that for example, in the pediatric gastroenterology clinic, the patients receive the letter literally as they leave the clinic. And now where a patient's assigned up to my chart, the letters appear there immediately. And clinical coding has improved, and other items about reducing the money that we historically were losing about high-cost drugs. Next slide, please. But more importantly, what we've tried to do is, and our constant focus throughout with our staff has been, this is not about technology. This is about doing the right thing for patients. So we introduced scanning for safety. We introduced the concept of barcode medication scanning, where at the point of medication administration, we now scan both the patient and the medication, and that helps to confirm those 5 rights of medication administration. And that was one of the concepts that we have worked on as in terms of developing a national blueprint for NHS England as part of our digital exemplar program. And so this ability to scan the patient and the medication, we calculate, saves us over 2,500 bed days, and that's a relatively conservative estimate. These bed days would be lost from adverse drug reactions. And whilst previously people were saying in our hospital, well, we weren't seeing lots and lots of errors, actually, the more we looked, the more we established that we were. And on a background of approximately 11,000 drug administrations a day, we still see on occasions between 5 and 15 times a day that the system is saying to the nurse, actually, this is not the right drug for this patient, or this is not the right time for that medication. And the nurses are really supportive of the system. They find that it really strengthens their care that they provide for the patient and keeps them safe, particularly in difficult times such as now. Next slide, please. The other thing we've done is to use the advanced decision support tools, underpinned most importantly by really, really strong clinical engagement, in order to develop workflows such as the work that we've done on sepsis. And the clinical engagement is really, really critical here. Being able to have clinicians define exactly what they want, how they want it to work, and how they're going to support the introduction and deployment of a new change in order for that to become sustainable change that's embedded in the fabric of the institution is critical. But a little while ago, we implemented changes around to help identify patients with sepsis arriving in the emergency department. It prompts nurses as to which tests to order and which tests to take. It brings the data together for the doctors, and we've seen a 70% increase in the number of patients receiving antibiotics within the first hour. And we know that for every hour of delay, there's a 7 to 8% increase in mortality. So again, a really pivotal change. And there are some tweets on this slide from a number of our patients who've really describing their benefits from that. Next slide, please. So how did we do against our HIMSS criteria? Well, back in 2014, the day before go live, we were a stage 1 hospital. Within a year of implementation, after a HIMSS inspection, 15th of October, we were rated as a stage 6 hospital, and then we revalidated as a stage 6 hospital in October 2018. And after more work, including the introduction of that barcode medication administration and some work on enhanced analytics to drive the delivery of high quality care, in October of last year, we were the first hospital in the country to be validated as stage 7 for inpatient care and the 7th hospital in Europe. Next slide, please. But the really critical thing here is about staff experience and engagement, because if you don't have that, then none of this is possible. And working with staff, ensuring that they understand how to use the system, ensuring that you take their knowledge and their expertise in driving how you develop and refine the system in its widest sense. So what are the changes to the clinical and operational workflows, and how does technology underpin them, is critical. And you can see here an annual survey, which unfortunately we weren't able to complete in 2020 because of COVID, which has shown a real progression over time of these net promoter scores, starting from relatively weak positions in some cases in April 2015 and strengthening throughout, but still more work to be done, particularly around support available for issues and changes. Next slide, please. So my lessons really are that digital maturity is a journey, but it does require an absolute change of mindset. And digital is not a bolt-on. It underpins everything that we do, and everything that we do has to be reinterpreted in how can the technology help you. It sounds really obvious, but you need to understand your staff and the roles that they undertake. At a very basic level, you know, is everybody who's called a secretary doing a secretarial type role, or are they doing very different roles? And so being able to critically and accurately describe the who, the what, the when, and the why in those operational workflows is really important. And typically the technology or digital becomes the how. When we engage with staff, we try to make the stories as real as possible. The more that you can relate to true patient experience, the greater the engagement. And we also need to remember that all of our staff at any time might unfortunately become unwell and become patients in their own right. And there is no such thing as too much staff engagement and change management. And the last comment that I would make is value and benefits can be measured in all sorts of ways, and they can be quality, safety, cash releasing, and so on. The reality is that cash releasing benefits are really hard to drive out, particularly in a system like the NHS. And whilst we need to make sure that the books balance and so on, so much of what we have delivered, it has really been more about quality, safety, efficiency, and freeing up time for more patient-facing care. Thank you very much.
Okay, good morning, everyone. And thank you for the opportunity to participate in this great forum. And thank you for taking the time out of your busy days to participate yourselves. I hope you find this session valuable, and I look forward to the potential to connect with you later. Next slide, please. I'm Angie Stockley, VP of Marketing and Communications for the MDF Commerce Strategic Sourcing sector, which encompasses integrated solutions for contract lifecycle management, supplier management, and e-sourcing, including the best-of-breed CLM platform, ASC. I've been managing successful digital transformation projects for both public and private sector for over 20 years, with specialization in business need analysis, emerging technologies, ecosystem integrations, and partnering for customer success. Digital technology RFPs and proposals are also under my mandate, so I well understand the pain points involved, defining your processes and requirements for technology and solutions, including managing solicitations, evaluating proposals, getting stakeholder agreement, and then managing contracts, compliance, and vendor performance. Likewise, I appreciate and utilize the automation and efficiency that technology and digitization enables. Today, we are discussing how the data imperative of healthcare digitalization can help expand your business insights, boost efficiency, and improve patient care. Next slide, please. Proactive insights means using rich, centralized data to drive better business intelligence and automation in your healthcare practice. Data insights are one of the main benefits of digital transformation and technology, reducing waiting times, speeding up diagnosis, and offering faster treatment paths. This has proven especially valuable in these COVID times when digital technology has enabled the necessary data access and tools to provide diagnosis and care virtually. In the process of delivering care, healthcare providers collect and store vast quantities of patient data, everything from admission, diagnostic, imaging, scanning, digital pathology, genomics, treatment, and discharge data. Additional data includes online interactions between patients and the providers, as well as data on the actual providers themselves. All this data is frequently underutilized, but represents a rich resource with the potential to improve care. But how best to leverage it? A centralized and accessible and easy-to-use data management system with strict enterprise-wide data governance across your stakeholder sets enables full data access and control when and where you need it, at the fingertips of your users. With this access, healthcare stakeholders have real-time and proactive insights into care delivery options, which can drive data-driven innovations that improve patient care, access, and delivery. With more advanced digital options, proactive insights, including patient care data, genetic history, lineage-based illness trends, pre-existing patient behavior data, such as how they've used your portal, are they keeping their appointments, as well as behavioral and social economic factors, enable healthcare professionals to provide preventative advice to patients, such as things to avoid to prevent a condition before symptoms are even evident. Prescriptive algorithms leveraging machine learning analytics can even be used to predict the likelihood of certain illnesses, for example, diabetes, and to chart more consistent and proactive plans to avoid costly unwanted hospital stays. The impact on emergency department and hospitalization use, decreased visits, which is a great thing, and to patients, such as things to avoid to prevent a condition before symptoms are even evident, are really substantial. As they say, prevention is better than a cure. Digitization and access to centralized and accurate data enables healthcare providers to quickly access and review individual patient data, improve the patient safety, take preventative measures, and even ensure better patient outcomes. And always, always, always ensure compliance and transparency. Next slide, please. Also, I do apologize. I'm recovering from a bit of an illness, so I may need to pause and take a drink now and then. The healthcare industry is one of the fastest growing in the country. In fact, healthcare spending all over the world is increasing, with governments allocating large portions of their budget to it, especially now. Because of the significant volume of daily expenses, even small productivity gains can have a significant impact on cost and resource savings, and big data analytics and business intelligence are incredibly useful ways to get there. The productivity and efficiency imperative is about using the key principles of intelligent efficiency to drive healthcare institutions that thrive in the future. Intelligent efficiency often starts with business process automation systems, which empower healthcare organizations with capabilities that automate and reduce the effort and errors related to repetitive and time-consuming administrative tasks. Think of things like processing referrals, health claims, test results, etc. Freeing your healthcare staff to focus on providing optimal patient care. Intelligent efficiency helps standardize processes with business rules and workflow, mitigate risk, and ensure regulatory and compliance management, combined with automated tracking and real-time audit reports, including role-based access controls that ensure the right level of patient data privacy and access. Digitization provides healthcare institutions with efficiencies that help prevent revenue leakage, drive cost control, and ensure full transparency, and deliver, again, better patient outcomes and provider profit. Numerous factors are known contributors to high healthcare spending, including market irregularities such as reimbursement protocols, compliance and regulatory requirements, excess supply of certain services, as well as control of the services demand around those same items, and patient factors, including social and behavioral health determinants. Often overlooked is the opportunity for productivity gains across all aspects of healthcare delivery. One of the fastest paths to improved healthcare productivity is the digitization of all those processes and the related data sets, which dramatically reduce cycle times, save resources, provide big data insights and business intelligence, and spend control, and most importantly, frees your team to focus on higher value tasks. The applications of process digitization and data centralization are manifold, as are the benefits. Digitization could be used in many ways by healthcare facilities to manage their data and processes better, including applications and supporting prime directives such as spend management to drive better cost control and reduce spending, compliance management fine-tuned to your exact standards and requirements in the healthcare sector, electronic health and medical records to help improve visibility of patient data, monitor safety and quality assurance, and improve safety and outlook, paramount to any healthcare facility, insurance claims and cost control procedures, contract management throughout the full life cycle, including obligation management, and e-sourcing to ensure you get the best value medical goods and services in your sourcing exercise. Just a little story here. As I said, I have been sick, and I was recently an emergency outpatient over a period of a few days, and I did notice the effects of too much data to handle manually. The intake, triage nurses and doctors were absolutely fabulous, but they were working from paper and clipboards, and they were very busy, and it was incredibly evident how quickly a mistake could be made. And in fact, I was on an IV, and I had two nurses try to give me the same intravenous medicine. Had I not stopped them, that could have been a problem. The data certainly was put into the system electronically at some point of time, either manually or by a scan. But it's easy to see how, a hospital or a healthcare organization or a person within those entities might run the same test multiple times on one patient, or deliver the wrong medicine or too much of something because of human or computer error. I could imagine if those same nurses had digital pads instead, and any of the treatment I received was immediately entered into the system. Certainly those types of mistakes with the digitization are rendered almost negligible. Next slide, please. Using contract management just to take a deeper dive analysis on the benefits you can expect with digitization. Think of things like centralized access from your whole team, from anywhere, any device. Easier, more intuitive processes that eliminate unneeded and unnecessary steps, and especially eliminate those manual ones. Accelerated contracting cycles, compliance management and risk mitigation, ability to request and create contracts in a simple and consistent way, leveraging governed contract templates and clause libraries, real-time collaboration and approval cycles with thresholds and different business rules built around that, simplified renewals and amendments, automated reminders for any key dates or milestones, accurate information, whether it's about a contract or your supplier or any other entity, cost control and revenue retainment, real-time complete audit trail, easy search and retrieval of contract information, again, at your fingertips type of protocol, and real-time proactive tracking and reporting. These digitized systems, prove that they reduce error, drive efficiency, and also, in this case, data automation allows you to get continuous feedback on how you can use your contract information to learn and get business intelligence to improve your performance over time. Optimally, whether it's a contract management solution or any other digital solution, it is about freeing your time to focus on those higher value strategic tasks and more efficient monitoring of the business side, means you have more time to spend administering premium patient care. This doesn't just apply to contract management, as I said, and a top solution should be flexible to address your very specific needs. Digitization helps provide a 360 view of whatever your data sets are or your main care about. It could be contract data that I was just talking about, patient data, spend data. The applications and benefits are endless, and the systems highly configurable to your exact business needs, process maturation, and complexity. It's easy to find a solution in the market that's the right fit for you, whether your needs are simple or complex. Digitization, simply put, drives efficiency and empowers you with the intelligence, insights necessary to optimize your productivity so you can spend more time on providing that optimized care. Next slide, please. At the end of the day, providing optimized care is the primary driver for digitalization in the healthcare circumstance. Digital data management and process management solutions help control costs and free your time and resources to focus on delivering optimal, higher quality patient care. There's no better motivator or result than that in healthcare. Next slide, please. Thank you, everyone. I hope you'll connect or hop over to the ASC digital booth sometime today or over the 365 days. I'd love to continue to have conversation around digitalization. Happy to share lessons learned and pitfalls to avoid. Happy to be, just a partner and discuss through and even share case studies and ROI templates and such if anybody needs help or support in any way. Always a partner to the market. Next slide, please. The ASC solution, which I mentioned as a best of breed CLM, is actually on the NHS LPP contract. We're the vendor of choice in the 2020 Technology Framework Agreement. Next slide, please. Again, related to our booth and sponsorship at the event, would love to have more conversation with people. If anybody would like a quick personalized demo, very happy to oblige. And as a thank you gift, a free coffee e-card. I will be here not just today, but for the full 365 days. So again, that's at your convenience as well. Thank you again and have a wonderful day, everyone.